This is the third episode in the Cancer Survivor series. In this episode, you will get to hear a doctor who is sharing her views and her experiences. We are going to speak to Dr. Sohini Sengupta in this episode. Dr. Sohini is currently working as Medical Laboratory Director and HOD Department of Clinical Chemistry and Special Assays at Redcliffe Labs India. She is an MD and DNB in Clinical Biochemistry and FNB in Laboratory Medicine. She has been previously associated with St. Stephen's Hospital, Sir Gangaram Hospital, and Max Healthcare. So let's welcome Dr. Sohini. Welcome on the show, Dr. Sohini.
Thank you. Thank you very much. Thank you for inviting me here.
Diagnosis is something that, which is the first stage in any, in case of any disease, I would say. But, with disease like cancer, it becomes all the more important to find out because as there are multiple stages.
Yeah.
So what stage generally cancer is, diagnosed in patients, and what has been the trend you would have noticed in patients?
Yeah. So basically, broadly speaking, there are four stages to cancer: stage 1, 2, 3, and 4. Stage 1, where it is localized to a particular organ, then where it has not spread at all. Then stage 2, where it has grown a little bit in size, where it's larger in size, yet it is restricted to that particular organ. Stage 3, normally where it has spread to the lymph nodes and tissues, and stage 4, where it has spread beyond beyond the organ where it has actually originated from. Now, there are cancers which are asymptomatic initially. So obviously, clinically, they may not present with certain signs as well as symptoms, whereas there are some which are symptomatic and they tend to present with certain typical symptoms or signs right from the beginning. So having said that, right now what we would say is from the diagnostics perspective, because I am heading a lab chain, what we see is there is a trend of people going in more for screening health packages, which I'll discuss later in this show, as a result of which in certain cases there is this possibility of detecting malignancies or cancers earlier than they used to be. So that is because of the trend of people going more towards preventive health packages, the more extensive ones of which include tumor markers as well. However, there are certain malignancies or cancers which are still not detected early and and are actually detected at a much later stage, which makes treatment and complete remission a little difficult.
Okay, so is it really possible to have a stage 4 cancer and then patient maybe not even aware of it? Does it
Yes.
happen that way?
Yeah, because there are certain cancers in which symptoms appear much later. Okay, say for example, ovarian cancers, in which a lady may be having an ovarian carcinoma with not many or with not many symptoms, or rather not many typical symptoms. So which would be help her identify that yes, there's something wrong with her, that she should go and consult a healthcare professional. So there are certain cancers, like I said, ovarian carcinoma, then cervical cancer, uh, testicular cancers, pancreatic cancers, etc., which often may be asymptomatic or have not so typical symptoms initial on, thereby leading to a later diagnosis, that is diagnosis at a later stage.
All right. So, what kind of a symptoms, you would say that, one should never ignore? Like, I'm healthy person, absolutely healthy, and then, I'm living a healthy life, but suddenly someday, I develop some sort of a symptoms. What are those symptoms which one should never ignore? Because, they may be a cancer sign.
So there is this sudden weight loss, which is easily noticeable but unexplained. So that is a very common symptom. Then, of course, a cough with spitting out of blood, then blood in stool, a feeling of heaviness, or maybe in the abdomen, or pain. Then some abnormal discharge. It might be from the vagina or the cervix, then from some small lesion, maybe in the breast or other parts of the body. Then any swelling which has been there for quite some time but suddenly shows a change in color or begins to grow very fast. So all of these should alarm the person to something being different and the need for them to consult a doctor immediately.
One thing which I really want to understand is that, you just said, a lot of symptoms, and then these symptoms, of course, maybe, a cancer sign. I
Yeah.
want to understand, these symptoms do come, in full force when they come, when they appear, or they gradually, start with maybe a little and then gradually aggravate with time, or maybe
Not
not with time. It can be as little as maybe a month for that matter.
Not really. So, some symptoms are very non-specific. They might not, indicate or direct someone to a particular organ. Say, for example, a very drastic weight loss. So, people sometimes feel, it's just like that. It's maybe because of stress or something. But that is something, if there's a huge weight loss which is unexplained, that somebody is not on a diet, then there's no other reason, like, diagnose diabetes or something. Then that is something which really needs to be sort of paid attention to. Then, of course, a sudden development of a lump in any part of the body, that may be the neck, maybe the breast, maybe on the skin, anything. Then sudden, coughing out of blood. Then, like I said, discharge from any lesion in the body. Then sudden unexplained, unexplained discharge, etc. So it is not that, there are certain symptoms which are associated with certain types of cancers, but there are also certain symptoms which are overlapping and some which are non-specific. So that is why, coming to the question that you exactly asked, it may not always be full blown when it is presenting itself. It may be initially present in a very dormant state, or maybe in a latent way, which suddenly starts to show a transformation, like sudden increase in size of a lump, or maybe, ulceration of that particular lump, or maybe a change in color, a discharge, etc. So these are things which might happen suddenly, and sometimes it may be just inside the body, maybe passage of stool, passage of blood in stool, passage of blood in urine. Then some growth of a lump in the uterus of a lady, which may or may not present with increased menorrhagia, with increased periods. Sometimes an ovarian lump, which often, just might lead to a heaviness of the abdomen and a weight loss, a dragging sensation in the pelvic region, but not present with symptoms which would be alarming. So I think, in today's time, people are quite aware. So it is important that they pay attention, or they pay heed to even small changes that they feel their body is suddenly undergoing.
All right. So, once a patient is diagnosed with cancer, how should he create the roadmap for the recovery?
See, I would first come to the screening part, and then I'll come to the diagnostics part. Screening,
Sure.
because it is very important nowadays, and with most of the diagnostic chains, including Redcliffe, offering a lot of preventive health packages, which help in screening and which are particularly designed for men and women separately. I think after a certain age, it is important for men and women to start taking these packages, and at least once a year, and get themselves screened regularly, not only for the more common tests, say for example glucose, HbA1c, LFT, KFT, CBC, etc., but also tumor markers which may be specific for certain conditions. Say, for example, in women, it is, I won't say it is mandatory, but it is always a good step or a good screening process to undergo some simple tests, say for example CA125, then for men to take the test of total PSA, that is prostate specific antigen, then free prostate specific antigen, that is free PSA, etc., which help in screening. And should there be anything wrong with them, there could be a possible increase in value. But again, no, a lot of tumor markers are not specific to a particular organ, so they might increase in both benign as well as malignant conditions. So a simple rise does not necessarily mean that yes, the person has cancer. It should be a significant rise, and the person should be having associated clinical symptoms as well for it to be correlated together, and then suspect the possibility of a cancer. Because obviously just saying that a person has a high value and it could mean a cancer results in tremendous mental trauma to the patient and their family. So it is important to be wise in that, to actually treat the high value or a particular aberrant laboratory result, correlate with the clinical symptoms, and then test further to conclude on the diagnosis of any type of cancer. So that is the screening part. And then coming to the diagnosis, obviously once a person goes to a doctor with any sort of symptom like the ones that I've already discussed, certain signs like fatigue, then weight loss, etc. Signs are the ones which the patient comes with, and the symptoms are the ones that the doctor sort of sees in the patient. So once the patient presents with certain signs and symptoms, and the doctor suggests a list of tests which include certain laboratory diagnostic tests like tumor markers if required, then pap smears, liquid biopsies nowadays, then biopsies, tissue biopsies wherever required. Then, of course, additional tests, say, for example, X-ray, CT scan, MRIs, all of that. A comprehensive outlook along with taking everything into account, starting from the clinical symptoms, the laboratory diagnostics, the imaging results. All of these have to be taken into account together to arrive at a final diagnosis. They should not be treated in an isolated fashion. We see a lot of people doing that. When we give out a laboratory result, they interpret it only on the basis of an isolated test result. Then they'll read up on Google and all of that. It might not be anything. So it is important for them to visit the healthcare professional, a doctor, and for the doctor to look at the entire thing in its totality, and then finally come to a diagnosis. Now, once the patient comes to to a final diagnosis of a cancer, it is very important that they move on to discuss with an oncologist, and then it is for the oncologist to decide whether the person needs a surgical intervention or a medical intervention, or initially a medical procedure followed by surgery, or vice versa. So that is why specialized care is very much required to ease out the entire process, and like you said, to determine the roadmap for their future.
Somebody has a cancer running in their family history, so they will have to, of course, go for repetitive, screenings in order to rule out that, they are not suffering from cancer, at least till whatever time
Yeah.
this screening happens.
Yes.
I have a related question also to this, which is, which you of course even mentioned in your answer in the previous question. While I am, trying to rule out that, I am not suffering from cancer just because, I have to go through this, since cancer is running in my, family history. I have to go for multiple screenings, maybe at a regular intervals. I don't know at what intervals it would be required for that matter. One, does it take a toll on a patient's, or even a healthy person's mental health? That is one. Two, going under the radiation every now and then may create, in case if there is no cancer at all, and somebody may not even have a cancer for that matter, but it is said that going under the radiation unnecessarily may of course put somebody at the danger.
Mhm.
So these are my two questions related to this particular, a G when there's a cancer in the gene. So how to really tackle this situation?
See, there are certain cancers which run in genes, and where the probability of the where the probability of having a cancer increases if the person's mother or grandmother, maybe aunts, have had a similar cancer in the past. So, why, like you said, it is obviously important to go for screening, but at the same time, it is also required to maintain that fine balance between screening as well as not overdoing it as well. So obviously it is a scary aspect, because when a person has gone through the trauma of having seen family members lose their lives because of cancer, or even suffer a lot, so they would be apprehensive. So there are certain simple tests. It's not that they should go for it every 6 months or every year. I'll give you an example of, say for example, ovarian carcinoma and breast carcinoma, which are both related to the BRCA1 and 2 genes. So it is recommended that, if there is a person, a lady who has had her mother, her aunts, grandmother, or sisters having had ovarian or breast carcinomas, that she gets herself tested for this BRCA genes to see whether there's a similar gene mutation running in her as well. Then, say for example, cervical carcinoma, which again is something which is very common amongst women. It is very recommended that women go in for cervical screening to detect cervical cancer at an early stage, even before it has occurred in that precancerous lesion stage, or maybe in the early cancerous stage, for her to be treated properly. Even then, what WHO says, or what the Indian government has also adopted, is not testing every year. So there, if HPV DNA, human papilloma virus DNA, is being tested, testing oneself every 5 years is sufficient. But again, if a pap smear or liquid based cytology, that is LBC, is being done, in that case it is recommended that it be done every 3 years. So then again, if there is a scare of breast carcinoma in the family, then going in for mammographies. But that's what I said. It's not something that one should be doing every 6 months, or every month. That is where they should speak to a healthcare professional, take proper guidance, and strike that fine balance to screen themselves at regular intervals, which, like I said, in case of cervical carcinoma, in case of cervical screening, would be every 3 years or every 5 years, depending on the test that the person is undergoing.
All right. So what are those, common types of cancer which are like, which people are suffering from generally these days? And one should be, sort of preparing themselves to, or if there is anything they can do, maybe, to abstain from those types of common cancers.
So I'll just take the example of India. In India right now, lung cancer, breast carcinoma, ovarian, cervical carcinoma, and prostatic carcinoma. So these are the ones which are most, five, you can say the five most common carcinomas or cancers in India now. Also oral. So it's basically oral, lung, cervical, then ovarian, as well as breast carcinomas. So, say for example, if you talk about what are the precautions that a person should take, so refrain from smoking. That is something that is very, very important. It is not only harmful to the person himself or herself, or but also to the people around them. So, I think the harm they cause through passive smoking. So, I think that is something, saying no to tobacco, to use of to smoking and use of tobacco. That is something that is obviously there are cases where cancer happens in the lung even without smoking, but those are some rarer cases. The higher preponderance is directly related to smoking, so abstinence from that. Then say for example, oral, again, chewing of tobacco, betel leaves, etc., which have an increased propensity to cause oral cancers. Then, like cervical cancers, in case of cervical, maintaining proper, there are certain guidelines for prevention of cervical cancers as well. In that case, the person should actually, again, it depends on their choice of partners that they have and all of, because it's a human papilloma virus, so that spreads, the genital route is the only way of spreading. In that case, for women who are already in the sexually active age group, it is important for them to get themselves again screened at regular intervals, so that even if they have a precancerous lesion, that is identified and detected early and they are treated upon. Likewise, for breast and ovarian carcinomas, regular self examination of the breast through the proper methods, the flat hand method, then using the fingertips. These are things which are being advertised a lot these days. I think it is important for women to self examine themselves once they reach a certain age group, and then depending on whether it is recommended by their general physician, their family physician, they can go in for a mammography also if required. For ovarian carcinoma, again, it is a silent killer because not often are there symptoms which are easily noticeable. But people should, in that case, women should look out for, certain drastic weight loss, heaviness in the abdomen, any pain in the abdomen, etc. So these are the five most common cancers in India which I've just spoken about. Of course, there are many, many more. Say, for example, thyroid, pancreas, testicular, colonic carcinoma, uterine, etc. So like I said, there are a variety of symptoms. So I think people should be aware if there's a lump in the neck region, to rule out thyroid gland, some lump in the armpits, then there's some abnormal discharge, then any lump in the testicular region, stool in urine, against stool in blood in urine, as in case of maybe kidney cancer or prostatic carcinomas, then blood in stool as in case of colonic carcinomas. So I think these are the symptoms which need to be watched out for, and people really need to be careful about.
All right. Okay, so when somebody is fighting to a deadly disease like cancer, they start looking for multiple alternatives as well, other than the allopathic. So, what do you think that alternative medicine works? One, two. Have you seen anybody curing from alternative, taking alternative medicine maybe, and then without any surgical or medical intervention?
See, obviously, we do read about a lot of alternative therapies, not only for cancer, but for different other diseases as well. And it is an age-old medicine that is being practiced in India. There have been lots of successes with that as well. So, I mean, it actually would depend on the person who is suffering or from that particular condition, and their family members, to decide on what they want to go in for, whether they want to go in for allopathic therapy, the surgical removal if recommended, or maybe medical like radiation, chemotherapy, etc., or they try for alternative medicine. There have been good results with alternative medicine as well. So it's more a matter of people's faith and trust in the system that they need to be treated with, that they want to be treated with.
Okay. So, cancer treatment is something which takes a toll on, a patient's mental health, family, and even at the finances for that matter.
Yeah.
Of course, there may not be, just one right way to take care of, a
Yes,
patient.
absolutely.
So,
Yeah.
so what are your suggestions? Like, the final one, of course, to
I
anybody who's
think
suffering from cancer.
I think it's very important to have that support system around them, because obviously there's the physical pain, the physical trauma that a person is going through, a series of surgeries, then radiations, and all of that. Then, but it's also a lot of mental uh, trauma, mental pain for the patient and the caregivers as well. So they don't need sympathy, but it's just that it is important for people around them, people they are working with, people living with them, their neighbors, everybody, friends, extended family, to be empathetic towards them, and facilitate the process, facilitate the journey that they are going through. uh, a person who is going through is not only going through the physical pain of it, but the scare, the mental agony, all of it. So it's a drainage on their finances as well. Then anxiety related to the success or the complete remission of their condition following the extensive therapy that they will go through. So a support system is very, very important. As a community, we really need to stand by them and help them, not only as doctors, I would say, not only with their diagnosis and their treatment, but also to make their journey just a little bit simple and easy. So I think that is what is required from all of us as a community.
Thank you so very much, Dr. Sohini, for sharing all this valuable feedback, insights on this very, burning topic. One thing, of course, is that once you are diagnosed with cancer, doesn't mean that there is no road ahead. I believe that there are, of course, chances with advancing medical support system in the country, and people are surviving, and of course can survive if they are having that right medicines, right support at the right time.
Absolutely. So, there should be emphasis definitely on screening as well as early diagnosis, just to make because, like I already mentioned, there are so many cancers which are maybe asymptomatic initial on or have non-specific symptoms. So, even whenever a person is sort of feeling that there's something different, it is important to talk to their doctor, get themselves screened to facilitate an early diagnosis, if at all it is the reason.
Absolutely, absolutely. Thank you so very much. Thank
Thank
you.
you. Thanks a lot. Thank you for inviting me. Pleasure.
Thank you so much.